I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Hot, humid weather can be hard on the skin. Rashes, bug bites, and fungal infections are especially challenging now. This is the People's Pharmacy with Terry and Joe Graydon.
Have you been postponing a trip to the dermatologist because of COVID-19? Well, that's understandable. It might not be smart. Some skin problems need professional attention.
How can you protect your skin from ultraviolet radiation and still get the vitamin D your body needs? Is it a myth that sunscreen blocks vitamin D production?
How important is the skin microbiome? How can you keep it in balance? How does diet affect your skin?
Coming up on the People's Pharmacy, learn how to care for summer-stressed skin.
In the People's Pharmacy Health headlines, does diet influence brain health? A new study in the journal Neurology suggests that a Mediterranean diet rich in vegetables, fruit, and fish may help slow the accumulation of harmful proteins in the brain. These proteins, amyloid and tau, form plaques and tangles associated with Alzheimer's disease. The scientists recruited more than 500 older individuals. About 60% were at high risk of developing Alzheimer's disease. The participants answered detailed questions about their eating habits and took tests that examined language, memory, and executive function like planning. They also were tested for biomarkers for the toxic brain proteins. Volunteers who reported eating more fish and vegetables and less meat or sweets scored higher on their tests of memory. They also appeared to have lower levels of tau and amyloid in their brains. The lead investigator commented, "These findings suggest that people may reduce their risk for developing Alzheimer's by incorporating more elements of the Mediterranean diet into their daily diets."
Most physicians agree that eating fish is good for the heart. There's less consensus about fish oil supplements. A new meta-analysis published in the European Heart Journal Cardiovascular Pharmacotherapy found that people who take omega-3 supplements may increase their risk of atrial fibrillation. This heart rhythm abnormality predisposes patients to blood clots that can lead to strokes. The research involved more than 50,000 volunteers with elevated triglycerides and at high risk for heart disease.
Atrial fibrillation is the most common type of heart rhythm abnormality. What's the best way to overcome it? Cardiologists have been debating this question for years. Options include antiarrhythmic drugs and anticoagulants versus catheter ablation. The latter strategy involves the passage of a catheter into the heart. Heat or cold energy is then used to create a small scar in the heart muscle to prevent an electrical signal from triggering an abnormal rhythm. A meta-analysis published in JAMA Cardiology compared ablation therapy to antiarrhythmic drugs for overcoming paroxysmal AFib. The review included 6 randomized clinical trials with over 1,200 patients. Catheter ablation reduced arrhythmias 38% more than medications did. Even more important, it cut hospitalization by 68% more. The authors conclude that catheter ablation should be considered as first-line therapy for atrial fibrillation.
Low back pain is difficult to treat, especially if it lingers. A randomized controlled trial suggests that osteopathic manipulative treatment might be helpful. 400 French patients with low back pain received 6 sessions of either genuine or sham osteopathic manipulative treatment. After both 3 months and a year, the genuine treatment resulted in less limitation of activity. The difference, while statistically significant, was modest.
People with insomnia face a difficult dilemma. On the one hand, they're told that a lack of sleep can contribute to diabetes, hypertension, and impaired cognition. But sleeping pills also come with potentially harmful side effects. Diphenhydramine, the sedating antihistamine in most PM pain relievers, has strong anticholinergic activity. That means it interferes with the critical brain chemical acetylcholine. Natural sleep aids are not always supported by scientific research. Now, a small randomized controlled trial in Belgium suggests that saffron may be an effective sleep aid. The 66 volunteers took either placebo or 15.5 milligrams of standardized saffron extract every night for 6 weeks. The volunteers wore devices to measure their movements and responded to detailed questionnaires. Both objective and subjective measures showed that people taking saffron fell asleep more quickly and slept longer and more deeply. They also reported less pain. The authors conclude that their results suggest that a saffron extract could be a natural and safe nutritional strategy to improve sleep duration and quality. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Summer can be hard on your skin. Heat, humidity, and ultraviolet radiation, not to mention poison ivy and bug bites, can all take a toll.
To help us overcome skin summer stressors, we turn to Dr. Krista Lagu. She's an assistant professor of dermatology and director of the Ethnic Skin Program at the Johns Hopkins University School of Medicine.
Welcome to the People's Pharmacy, Dr. Krista Lagu.
Hi, thank you so much for inviting me. I'm really excited to be on the show today.
Dr. Agu, summer's a busy time for dermatologists. There are itches, there are ouches, there are bug bites, there's rashes, there are infections. And this time of COVID-19, people are probably a little reluctant to go to the doctor's office or to the dermatologist's office. And so they try to suffer in silence and maybe it'll go away. And so I'm guessing that things don't always go away by themselves and people end up in your office in bigger trouble than they normally would at this time of the year. Can you tell us a little bit about what it's been like practicing during the coronavirus and what people are showing up with these days?
Absolutely. I mean, you're absolutely correct. So 50% of the patients I see are people who have a problem. They know it. It's obvious, something that's painful or bleeding, and they're coming in because they're like, I need you to check me out, right? And I'm talking pre-COVID. But the other 50% of people are people who are just like, you know what? I just felt like it was time to get a check, or my spouse really encouraged me to see a dermatologist, and I just need this to be over quickly and I'll be on my way. The thing about both of those groups is that we see things that are scary, like skin cancer, with equal frequency. So I have patients who have no idea that they have a melanoma that's been growing on their back for likely several months and subsequently require things like chemotherapy and surgical treatment. The issue with COVID is that really I'm probably only going to see the first group, right? I'm really only going to see people who really feel like they have an absolute issue that needs to be addressed and is actively impacting their quality of life. So because we're still in the midst of the pandemic, I haven't seen anybody in that second group. I'm not really seeing people who are just kind of like, I don't think anything is wrong with me, but I figured I'd come in. And so what I fear is that 12 months from now, we are really going to start seeing a rush of patients who are presenting with more advanced stage diseases like skin cancers or other conditions that really would have been better treated at an earlier stage, but we really were just missing them at a time when it wasn't such a big issue for them. But as a dermatologist, we really would have been able to pick up on it.
So that sounds very worrisome. And people, of course, have no idea that they might fall into that second group because, as you pointed out, these are people who don't know there's anything wrong. They don't know there's a melanoma on their back or under their big toe or wherever it happens to be. How can we get people to come into your office when they need to?
That's a great question. And I will say this issue is not unique to dermatologists. I'm a part of a lot of physician Facebook groups and other social media groups, and we're really seeing this across the board. So even when we think about things like heart disease or diabetes or high blood pressure, a lot of these are conditions that really exist and get worse without any symptoms. And so I've seen a lot of my pediatrician colleagues really making a big push, telling parents, don't forget that your kid needs their, annual checkup. They need their vaccines, and really just making sure that people remember that a big part of medicine is preventative care and preventative screenings and trying to catch people at these really early stages before things get out of hand. And so I think as things in the pandemic kind of quiet down a little bit, my hope is that that message will become louder and stronger. And so I would say, generally speaking, if you're someone at increased risk of certain medical conditions, such as skin cancer, so you have a strong family history of it, even if you think nothing is wrong, you still should come in and get your skin examined. And similarly, if you have a strong family history of diabetes, even if you feel great, you should not skip your annual checkup with your doctor just to make sure that things are okay. We really can't put everything else on the back burner, because then in some ways, a year from now, we'll be dealing with a second type of pandemic, and it'll really be an explosion of all of these health conditions that are at a more advanced stage.
Dr. Agu, we don't usually think of our skin as an organ. Should we change that way of thinking?
Absolutely. Not only is the skin an organ, it's actually the largest organ in your body. And the purpose of the skin is really to be the first line of defense against infection. So that's actually one of the main functions of the skin, but certainly it keeps your temperature regulated as well and serves a host of other functions. And so it can be easy for some people to forget that they have to take care of their skin in the same way that you have to take care of your body. But if you forget that, just like your body or just like even your car, eventually over time, without appropriate care, things can break down.
Well, Dr. Agu, I'm really glad you mentioned the car, because when I think of the skin and temperature regulation, I think of the radiator in the car, because that's basically, how the air goes through the regulator and keeps the engine cool. And the same thing sort of happens in our bodies. It's our skin and sweating that cools us down during the summertime. And it's hot out there right now, but I worry about medications. There are a lot of drugs that people take that dry them out. And as a result, they're much more susceptible to heat stroke and all kinds of problems associated with, the hot weather. Can you give us a little quick overview of why the skin is so important to cool us down and what we need to be alert for if it's not doing its job well?
Absolutely. So just like you mentioned, when we are exposed to very hot environments and it's really, really hot outside, that signals our body to produce sweat to cool the skin down. The issue is if you're very, very dehydrated, and like you mentioned, there are some medications that can do this, that kind of work by expelling water from the body, you may have decreased amounts of sweat, and this can certainly increase your risk of heat stroke. There are actually a very small proportion of people who actually have a genetic inability to produce sweat, and they certainly cannot stay outdoors. There are also other conditions where people's skin doesn't function properly. They may have decreased layers of the skin, so fewer layers of the skin, or the layers they have are not normal compared to what we would expect. And those patients are also at increased risks of not only just skin cancers, but heat stroke and dehydration. So absolutely, at a time like this in the summertime, having skin that's really performing all of its functions it's going to be very important.
Now, as long as we're talking about summertime, I want to ask about sunscreen. We are always told you have to wear sunscreen in order to prevent a sunburn, of course, but also to prevent skin cancer. And I think a lot of people are reluctant perhaps to wear sunscreen. And particularly, I'm wondering about people with darker skin. Do they also need sunscreen, and are they aware of that?
This is an excellent question. It's very timely. It's actually somewhat controversial right now within the field of dermatology. So sunscreen is super important for many different reasons. I think the reason that people identify with the most is really prevention of skin cancers. And we're really talking about skin cancers like basal cell cancer, which is the most common cancer in the world, squamous cell skin cancer, but not necessarily melanoma, which is the deadliest form of skin cancer, but has some genetic contributions when it comes to who's at risk for it. But sunscreen absolutely protects your skin from damaging sun rays. Those sun rays, when they hit the skin, can damage the skin cells. And if you get enough damage over time, you can develop a skin cancer. But one of the other benefits of sunscreen that people talk less about is actually the aging benefits. So a lot of the sun damage that we get results in the wrinkles and fine lines that people associate with aging. And so even if you are someone who is at lower risk of skin cancer, like someone who has brown skin or is more deeply pigmented, you would still benefit from using sunscreen on a regular basis if you are interested in getting rid or preventing those signs of aging.
Now, who isn't interested in preventing wrinkles if you're still in a position to prevent them?
Right. I think everybody
Some of us are beyond
really
that.
interested. But, to your latter question about brown skin and skin cancer. So brown skin inherently has a natural sun protection factor, or SPF. And depending on how deeply pigmented you are, it probably ranges anywhere between 4 and 13. But having that sun protection factor on the skin every single day, not something that you have to reapply every couple of hours, is enough to largely prevent the vast majorities of sun-related skin cancers like basal cell and squamous cell. However, what gets lost in that conversation is that sometimes people with brown skin think that they're not at risk for melanoma. And I don't know how many people know this, but Bob Marley actually died from melanoma. That's because, again, melanoma is not directly tied to sun exposure. There are different types of melanoma, and some are certainly related to blistering sunburns and tanning beds. But the type of melanomas that people with brown skin, whether they're of African descent, Asian descent, Hispanics, most commonly occurs on the hands and feet, particularly underneath the nail bed, which really isn't getting any direct sun exposure at all. So just by saying that people with brown skin don't need to wear sunscreen to prevent skin cancer does not mean that people with brown skin don't get skin cancer. It's just that even if they wear sunscreen, they're not necessarily decreasing their risk of the skin cancers that we sometimes get concerned about in brown skin.
You're listening to Dr. Crystal Agu, Assistant Professor of Dermatology and Director of the Ethnic Skin Program at the Johns Hopkins University School of Medicine.
After the break, find out about detecting melanoma on dark skin.
How do dermatologists learn to identify a problem like eczema or lupus on darker skin?
Learn how to deal with summertime skin yeast infections. Heat and humidity can make fungal infections more challenging.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's KAYA Biotics.com. Use the discount code PEOPLE for $10 off your first purchase. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by CocoVia, maker of high-potency cocoflavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
Also by Verazana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Today we're talking about how to care for summer-stressed skin. Fungal infections like jock itch or underbreast rash can be much more troublesome when the weather's hot. At this time of year, bikini bumps may also be a problem. How can people deal with them? And a related problem, razor bumps.
Our guest is Dr. Krista Lagu. She's an assistant professor of dermatology and director of the Ethnic Skin Program at the Johns Hopkins University School of Medicine. Dr. Lagu's area of research focuses primarily on skin conditions that disproportionately affect minority populations, with particular emphasis on hair loss.
Dr. Lagu, you have pointed out that people with darker skin may not be as susceptible as people with very pale skin to things like basal cell carcinoma, squamous cell carcinoma, but they are still susceptible to skin cancer. Can you tell us about melanoma, please?
Absolutely. So melanoma is considered the deadliest form of skin cancer. And this skin cancer certainly occurs more commonly in people with fair skin, but particularly on body sites like the back, the arms, the legs. But people with brown skin can still get melanoma that is just as deadly. But classically, those forms of melanoma occur on the hands and feet, as well as underneath the nails. So Bob Marley, who passed away from melanoma, actually had melanoma on his foot. And what we do know about melanoma and brown skin is that it tends to be diagnosed at much later stages, probably due to a host of factors. One being that people with brown skin just aren't aware that they're at risk for skin cancer, so they may not be checking their skin on a regular basis. They may also not see a dermatologist on a regular basis. We know that people with brown skin are less likely to see specialists for medical care. And then lastly being that these melanomas, because they're happening on the hands and the bottom of the feet, they can be just really tricky. So very few of us look at the bottom of our feet on a regular basis. And so that's a lot different than someone who develops a melanoma on the face or the chest, where it's quite visible to them and easier to pick up on.
Dr. Lagu, there may be one other factor that might interfere with diagnosis, and that is that so many dermatologists are not as aware of a presentation on darker skin color. Can you address that, please?
Absolutely. So I always tell my medical students that dermatology is very unique because when we think about other organs like the heart, the kidney, the liver, we realize that these organs are basically identical from person to person. So if I want to diagnose high blood pressure, I have, one set of criteria. And if a person meets that criteria, well, they have high blood pressure. And if I want to diagnose diabetes, it's the same thing. But the skin is very different. So if I am diagnosing eczema, I have to understand that this same process, which may look identical under the microscope, looks completely different to the naked eye from person to person, largely dependent on the amount of pigment in their skin. And so that makes us incredibly unique in the field of medicine.
How do dermatologists learn how to identify a problem like eczema, for example, on a darker skin?
That's a phenomenal question. And I'll tell you that answer has changed over time. So 30 years ago, it really depended solely on where you trained. So someone who trained in the Bronx is going to feel much more comfortable diagnosing eczema on brown skin than someone who trained in, let's say, Iowa. And if you trained in Iowa, the assumption was that probably you would stay around the area. And so maybe you didn't really have to know how to diagnose eczema on brown skin, except, with the exception of a few of the darker pigmented patients who live in the area. But as time has gone on, fortunately, we're seeing just a larger call for including skin of color and different presentations of skin diseases on pigmented skin to be included in the more widely available dermatology curriculum. So that includes things like lectures, that includes changing the textbooks, and additionally identifying specialists in diseases that affect people with pigmented skin. But where we are now is really miles and miles away from where we need to be.
Well, I'm worrying about things like lupus, for example, or perhaps a drug reaction, because there are drug reactions that are really, really serious, potentially life-threatening, or even something that's, fairly simple, like contact dermatitis or seborrheic dermatitis. How do different skin colors respond to these different kinds of conditions, especially when it's kind of serious like lupus?
That's a great question. So lupus is simply just more common in people with brown skin, especially young Black women. And so number one, you have to be thinking about that very highly on your list when you see someone with, let's say, very pink cheeks, right? So if I see someone with very pink cheeks and they're brown skin, well, I'm thinking of lupus. Obviously I'm thinking of rosacea, but I really have to be thinking about lupus too, as opposed to someone who's very fair skinned with freckles and red hair and who has pink cheeks. Rosacea is going to be a little bit higher on my list. Now, certainly you're going to ask all the right questions for everyone, but similar presentations, the list of our differential diagnoses and the things that we're considering can look very different. Now, things like seborrheic dermatitis, which is one of the most common conditions that we see, can look very, very different on brown skin. For example, with normal seborrheic dermatitis, you get kind of flaking, just dandruff in the scalp. You can also get it on the face. In brown skin, some of these patients have minimal flaking and they just have large white patches on the face, particularly around the nose and the eyebrows. Now, I've seen a lot of dermatologists see this and they're like, well, I have no idea what this could be because I'm simply seeing this discoloration. But an understanding of the presentation of seborrheic dermatitis in brown skin and knowing that it can present completely differently makes it easily identifiable. And so it's interesting how so many of these very common processes can look so different on different skin types and still, again, be identical underneath the microscope.
Now, Dr. Agu, we used some technical terms, and I'd like you to just give us some brief definitions. We talked about lupus, and we talked about rosacea, and we talked about seborrheic dermatitis, and they're all big words. So
Yeah.
if you wouldn't mind just explaining very briefly what we're talking about here.
Yeah. So lupus is a common autoimmune condition where the cells in your body that are programmed to attack bacteria and viruses start to attack your body as a foreign infection. And so with lupus, you can actually see this attack against the body on a variety of organs. So you can have these autoimmune cells attack the kidneys, and then we call it lupus nephritis. They can attack the heart, and we'll call it lupus carditis. They can attack the skin, and we call it cutaneous lupus. So you can have a variety of different forms of lupus. And for reasons that we don't understand that well, autoimmune conditions like lupus occur more commonly in young women of all ethnic backgrounds. But then there are certain autoimmune conditions like lupus that are more likely to occur in Black women in particular. So that's lupus. Rosacea, I like to call rosacea the cousin of acne. So it's kind of like an adult form of acne. Traditionally, we see it most commonly in fair skin types, and the most common appearance of rosacea is just kind of this ruddiness and redness on the cheeks. But more severe forms of rosacea cause deformities of the nose. So the nose can take on kind of a mushroom-like appearance, and patients can also develop a lot of acne-like breakouts around the face and mouth that don't respond to typical acne medications. And then lastly, seborrheic dermatitis is just a fancy name for dandruff. Certainly, there are varying degrees of dandruff. And so as a dermatologist, when we say dandruff, we really mean very mild seborrheic dermatitis. And then true seborrheic dermatitis is very angry, red, and inflamed dandruff that we see on the skin and scalp.
And I can say from personal experience, it's also extremely itchy.
Yes. It is very, very itchy. And that itchiness is one of the reasons that it is one of our more common complaints, because itching significantly impacts your quality of life.
Dr. Agu, I'd like to talk a little bit about some of the summer problems that people encounter. And I'm guessing that fungal infections are pretty high on the list, in large measure because fungi love warm, moist, and dark places. And that can happen oftentimes more in the summer than in the winter. So let's talk a little bit about how a dermatologist deals with all of the different places that fungal infections occur. And then I'd like to talk about another summertime problem in a second, and that has to do with something that women complain of, and that's bikini bumps, and men complain about when they shave, especially African American men, pseudofolliculitis barbae. But first, let's start with fungi.
Yes. So this is the perfect time of the year for people to develop fungal infections for exactly the reason that you stated. It is really hot outside. We're sweating very easily, and yeast and fungus, they love warm, wet environment. So the most common location that I see this is underneath the breasts for women, and then certainly for anyone kind of in between the thighs. And I have a couple of just really easy remedies for that. So certainly keeping the area dry with a powder is helpful, but there are some over-the-counter antifungal powders that are even more effective. The second thing that people should realize is when these fungi and yeast kind of settle into the skin, they actually cause inflammation of the skin. So another thing that we use to treat this is like a topical steroid cream, which is an anti-inflammatory cream to get rid of that redness. So the combination of the antifungal cream and the topical steroid cream can really kind of pack a 1-2 punch. And then by the time things start to cool down in the fall and winter, we typically don't see these complaints as quite so much.
So I'd like to get names, please. What are your favorite remedies to deal with, for example, fungal infections of the skin?
Yeah. So if I'm dealing with infections underneath the breast, for example, and in between the thighs, then Zeosorb powder, which I think is a miconazole powder available over the counter, is really, really helpful. But if I'm dealing with things like athlete's foot, then I actually love over-the-counter Lamisil cream. The generic name for that is terbinafine cream.
Oh, that's very helpful. And I know a lot of people suffer from that underbreast rash, which is not so very different from what men call jock itch.
Exactly. That is exactly jock itch. And jock itch occurs when you spread fungus from your athlete's foot to the groin area. And so that's how people get that.
Now, what about pseudofolliculitis barbae in men? Please tell us what it is and what causes it. And for women, bikini bumps.
Absolutely. So pseudofolliculitis barbae is the scientific name for razor bumps. And so this occurs most commonly in people with very curly hair, of whom obviously African Americans, people of African descent are going to represent a large proportion of those patients. What happens is that when you shave, you basically cut the hair right at the layer of the skin. And then as it grows back out of the skin, it can curl into that opening. And that curling in then starts an inflammatory process, which leaves a very, very itchy, painful bump behind. And every time you shave, that process can continue and worsen. And over time, you can see someone with numerous very painful bumps, which as they heal, leave behind dark marks. So the same can be said for bikini bumps. So this is the same process, but one of the reasons why this is so common is because people find that in the groin area, their hair tends to be thicker and curlier than other areas of their body. And so even if you don't get bikini bumps anywhere else, if you're going to get them in one place, you're going to get them there just because of the quality of the hair. And so the process is the exact same.
So what do you do, whether it's from shaving or bikini bumps?
I am so glad you asked. So I love treating razor bumps because I think that this is such an easy fix that changes the quality of life. I will say when I was training, a lot of dermatologists would tell patients, well, stop shaving and then you'll get rid of it. But for most people, that's not a sufficient answer. So there are a couple of things that you can do. So one, using clippers to create a relatively close shave, but not to the top layer of the skin, is going to decrease your chance of that hair curling back into the skin. But if you do want a close shave, one thing that you can use is a topical retinoid cream. Examples of those would be things like Differin gel or Retin A. What that does is it minimizes the skin cells that will trap the hair as it curls back into the skin because it works as an exfoliator. So by removing those dead skin cells away, you have fewer things that can be trapped into that bump. So I tell people who suffer from razor bumps to use that on a daily basis as a preventative measure. Additionally, immediately after shaving, because the shaving process is traumatic and there is evidence of microscopic inflammation, applying a light or very mild topical steroid ointment immediately after shaving is going to decrease that level of inflammation that already exists immediately after shaving. And then the last thing to do is use a topical antibacterial cream or gel after shaving as well. And that can also be used as on a daily basis to wipe away the bacteria that lives on the skin. Because again, as the hair curls back into the skin, if it gets trapped with skin cells and bacteria, you're much more likely to get a very painful bump that will persist and then eventually leave a dark mark.
So let me see if I've got this right. You start with the Retin A, an topical acne treatment.
Right.
And that exfoliates. Then you use I assume, topical OTC corticosteroid cream like cortisone cream. And then you finish with an antibiotic. And do you have any preferences?
So topical benzoyl peroxide, which is actually also in the acne aisle, is great. And the reason I like this is because bacteria do not become resistant to benzoyl peroxide, as you may know. And I will, just to clarify, you kind of have a preventative regimen and then you have an immediately post-shave regimen. So the topical antibiotic and the topical retinoid would be something that you would use on a daily basis because a lot of these things take time to work. But then the topical corticosteroid or the anti-inflammatory cream or ointment would be used immediately post-shaving just to eliminate that initial inflammatory phase.
You're listening to Dr. Krista Lagu. She's an assistant professor of dermatology and director of the Ethnic Skin Program at the Johns Hopkins University School of Medicine.
After the break, we'll finish our conversation about bikini bumps.
And we'll talk about masks and acne. What can you do about maskne?
Contrary to popular opinion, acne doesn't just affect teenagers. Adults should know how to treat it too.
What about diet? Are dermatologists revisiting their opinion about how foods affect the skin?
Does sunscreen block the formation of vitamin D? Or was that a misunderstanding?
Dr. Agu offers advice on keeping our skin as healthy as possible, even in stressful times.
You're listening to The People's Pharmacy with Joe and Terry Graydon. The People's Pharmacy podcast is supported in part by CocoVia Memory Plus. CocoVia cocoflavanols support both cardiovascular health and cognitive function by promoting healthy blood flow, transporting oxygen and nutrients to vital organs and muscles, including your heart and brain.
CocoVia Memory Plus has 750 milligrams of cocoflavanols, the plant-based nutrients from fresh cocoa that have been proven to help boost memory.
CocoVia Memory Plus is backed by 4 clinical trials that demonstrate improvement in 3 different aspects of memory: long-term memory, spatial memory, and word recall. The studies show improved brain function in just 8 weeks.
You can try the benefits of CocoVia Memory Plus with a 25% discount off your first month. Use the code PEOPLES25. To get the full benefits, take it daily for 8 weeks. CocoVia is offering People's Pharmacy podcast listeners a 10% discount on subscriptions. That code is Peoples10. Learn more at cocovia.com. Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by CocoVia, the maker of high-potency cocoflavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
Also by Verazana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Today we're talking about caring for summer-stressed skin. In addition, the pandemic has thrown us some curveballs. Wearing a mask can make acne worse. How can you stay safe and keep your skin healthy as well?
Our guest is Dr. Crystal Agu. She's an assistant professor of dermatology and director of the Ethnic Skin Program at the Johns Hopkins University School of Medicine.
Dr. Agu, we were talking about bikini bumps as well as pseudofolliculitis barbae, and you gave us a great treatment for those shaving bumps. But what about the bikini bumps?
Yeah, so the bikini bumps I actually approach totally differently. And that's because there are so many options for hair removal that are going to be a lot less traumatic for the skin in that area. So I generally recommend one of two things. One is waxing that area. So even though waxing is more painful, it's actually less traumatic to the skin than shaving the skin. And I try to remind my patients, like if you shave your legs or you shave your underarms and then you spray perfume on your skin right after, you'll feel an intense burn. And that's because you have so many microscopic cracks and fissures in the skin. And all of those areas are enough to give you that inflammation that later leads to the bikini bumps. But if you do waxing, you get less of that because waxing is just much more efficient at just pulling the hair directly out of the follicular opening in the skin. The second option is using a depilatory cream. So a depilatory cream actually works by kind of melting the hair. So then the hair just easily slides out. And so then when the hair grows in, it actually grows in complete and it's not cut at an angle like it is when you use a razor. That being said, as the hair grows back in, some women will notice some mild itching, which is a sign of inflammation. And at that point, they can also apply an over-the-counter topical corticosteroid, again, to minimize any chance of small bumps. But I would not recommend the topical retinoid or the topical antibacterial agent in this area on a regular basis like I would for the face.
Dr. Agu, we are in the middle of a pandemic. We are all supposed to wear masks, and I hope we are all wearing masks when we are out where there are other people, because that is one of the better ways we have right now of stopping the virus. Are there repercussions for the skin? Do people get worse acne when they have to wear a mask for a long time?
I certainly wish the answer was no, but the answer is yes. So I'm definitely seeing more cases of maskne, which is what people are calling it these days, not only in patients, but even in some of my colleagues. And
sure.
This happens more commonly in people who are wearing masks for several hours a day without any breaks. So it's less likely to happen in people who are, let's say, running to the grocery store or running an errand and need to put on a mask before they enter a public space, and more so for someone who's wearing their mask for 8 hours a day. And really what's happening is that physical pressure is creating some inflammation and clogging the pores, and you can get some very small acne-like bumps, which we call comedones, on the skin. So what I've been recommending is actually just the use of a gentle exfoliator. So again, topical retinoids are our friends, and they can be found over the counter or by prescription. But you can also do things like using a scrub brush to kind of gently exfoliate your skin at the end of the day. And then the last thing I would say is if you're using a mask and you're wearing a mask all day, I would avoid using heavy amounts of makeup or other products that are really going to clog the skin.
I'm kind of curious about acne in general, because most people think of acne as a teenage problem. And for decades, we were told, yeah, diet doesn't matter. It's not what you're eating. And now the pendulum has sort of swung in a different direction. And there have been some suggestions that indeed carbohydrates may be problematic.
Oh, and dairy.
And I remember talking to dermatologists 20, 30 years ago, and the number one go-to medicine was always an antibiotic, oral antibiotic, usually some form of tetracycline. And nowadays, everybody's sort of worried about the microbiome and how antibiotics can change the bacterial ecology. So now people are worried about the bacterial ecology of the digestive tract if somebody is on an antibiotic for 5 or 10 years. So can you kind of bring us up to speed on where the dermatology community is when it comes to acne, the diet, and also the fact that it's not just teenagers anymore?
Yeah, these are excellent questions. And I'm just so excited that you are so up to date with the dermatologic literature, because I want to tell a cool story about the microbiome as well. But I'm going to start with your first point about acne and diet. And honestly, I would not even say 30 years ago. I would say 10 years ago. So 10 years ago, we would really poo-poo the influence of diet on acne. And I will tell you, when I see teenagers, all of their parents want me to tell their teenagers to stop eating pizza and cookies and burgers. And I refuse to do it because teenagers have an amazing metabolism and they should enjoy it while it lasts. That being said, we have definitely seen that there's an association and a link between acne and diet, particularly as it pertains to dairy. So, and really animal-based dairy, because a lot of the animal-based dairy that's in our food supply is actually treated with hormones. And we believe that those hormones then exacerbate acne. But in addition, high carbohydrate diets high in sugar and white flour can also lead to worsening acne. And there was a study that was done of a very remote population in the Pacific Islands. And there were a team of epidemiologists and dermatologists, and they went from house to house in this very, very small community, and not a single person had a single acne bump. So they were actually counting acne lesions, and it didn't exist. As opposed to in America, especially particular ages, we have a 90% or greater rate of acne. Even if some people only get one spot a year, a majority of teenagers and young adults in our country will experience acne. So certainly diet plays a significant role. We still use antibiotics as one of our first line treatments, but you're absolutely right. I think a lot of us, if we do use antibiotics, really want to limit its use to a couple of weeks at a time. And we rely more heavily on topical medications for long-term control, because even when antibiotics work, the effect is so limited. And we know that no one can stay on antibiotics for several months at a time.
What kinds of topical medications do you use for acne?
Yeah, so just like razor bumps, our go-tos are topical retinoids and topical antibacterial agents. And we like topical retinoids because, like I discussed, they have an exfoliating property to them. They actually increase skin cell turnover. And so they help acne bumps, they make them less likely to form, but they actually help them resolve faster. And then particularly in people with brown skin, acne breakouts leave behind dark marks that we call post-inflammatory hyperpigmentation. And because retinoids are increasing that skin cell turnover, they clear those dark marks faster without bleaching the skin. And then the topical antibacterial agents are really targeted towards a bacteria called P. acnes, which is one of the most common forms of bacteria that we see. It's particularly in acne bumps that are red, nodular, and cystic, things like that. And so we use those as agents, like synergistic agents that work well together to help us combat acne.
And the myth that acne is just a teenager problem?
Totally a myth. Totally a myth. Especially in women, on average, acne does not resolve until their mid-50s. So if anyone was hoping that a dermatologist was going to be on the show and tell them that don't worry, like your acne will end by the time you're 25 or 35, unfortunately, I cannot promise you that. We're really into the mid 50s for that. So total myth.
I'd like to change gears again, if I may, and talk a little bit about vitamin D and sunscreen. And I have to admit, we goofed. And we've goofed in our newspaper column as well as on the radio because we'd been told many years ago by a vitamin D expert that using sunscreen was going to prevent the skin from making vitamin D. And more recently, we have discovered that not so much, that you can use sunscreen and still make adequate amounts of vitamin D. But I'm wondering about darker skin and vitamin D levels and whether sunscreen can be a problem there. Could you give us a little insight?
Yeah, it's a great question. You actually don't need that much sun exposure to produce vitamin D in the skin, but certainly we see vitamin D deficiency more commonly in brown skin. But you have to, like we talked about towards the beginning, there is this natural SPF that's found in deeply pigmented brown skin. And, when we think about it from an evolutionary basis, the type of sun exposure that people were with brown skin were getting in places like South Asia, Africa is a lot more intense than we get here in more northern climate. So certainly we do expect that some of that vitamin D deficiency is just due to kind of that mismatch in where our skin is now residing, right? And the same can be said for people who are very fair and live in Australia, right? There's a little bit of that mismatch as far as where your skin is kind of positioned to be and where it actually ends up. But that being said, as dermatologists, we really push vitamin D supplements. So we get a lot of patients who, let's say, are at high risk for skin cancer and have kind of subscribed to this myth of needing significant sun exposure to increase their vitamin D levels. And to that, we almost always say that vitamin D supplements are going to be a much safer way to get your vitamin D levels back to normal as opposed to getting too much sun.
Dr. Agu, you mentioned the microbiome. What does the microbiome have to do with our skin?
Oh my gosh, the microbiome is so interesting. So like you guys mentioned earlier, the microbiome is basically the resident bacterial population that lives on an organ. Okay, so you have a skin microbiome, you have a gut microbiome, and you have a microbiome on your scalp and different parts of your body. And the microbiome varies from person to person. And as many people are aware, we have healthy bacteria that kind of keep this natural equilibrium intact. And then we have bad bacteria that can cause infections. And what we found about the skin is that when we look at patients, like let's say with eczema, the microbiome of patients with eczema is actually very different than the skin microbiome of patients who don't have eczema. I'm a hair loss specialist, and one really cool thing we've learned about the microbiome is the potential role that it plays in autoimmune diseases. So one of the forms of hair loss that I study is an autoimmune form called alopecia areata, where again, these skin cells that are supposed to protect us from infection start to attack the hair, and people lose it. But there are some excellent studies that have shown that if you do a transplant of feces, so a fecal transplant from a patient without alopecia areata to a patient with alopecia areata, their hair will grow back. So that is just one example of how the microbiome can really, open our eyes into the pathogenesis and our understanding of these different skin diseases. So it's really cool. So you would never think that someone who had lost their hair to this autoimmune disease, if you just gave them someone else's feces, that their hair would grow back. But the thought behind that is that if you change the microbiome in the gut, then the natural inflammation that exists in the body may normalize and may tilt towards a different presentation. So we have so much to learn about the microbiome, but it's one of the coolest things in all of medicine. Certainly, and I'll tell you how they do that fecal transplant in case that was your next question. There are actually companies that will package the fecal matter into capsules They're tasteless, but usually these fecal transplants are done between spouses. So you wouldn't necessarily get it from a stranger. And that's really for the mental part of it, not necessarily because you need to get it from a spouse. But I just think from the patient's perspective, it's maybe a little bit easier to swallow, no pun intended, but lots of indications for that. And that's actually one of the main treatments of a type of colitis called C. diff colitis is a fecal transplant. It's actually one of the first line therapies.
That is fascinating. Thank you. And now we have almost no time at all left. So, Dr. Agu, what general advice do you have for all of us to keep our skin as healthy as possible?
Absolutely. I have a couple of tips, some of which we've already touched on today. I am a big fan of sunscreen for everyone for a variety of reasons. Certainly those who are at high risk for skin cancer will benefit from its use. But I think if you are interested in developing an anti-aging skin regimen, this has to be part of your arsenal. And it's also going to help minimize any discoloration. So that's a benefit that we see, particularly in our patients with brown skin. Also a big fan of exfoliating the skin. Whether you use a manual exfoliator like a scrub brush or a chemical exfoliator like Retin-A or glycolic acid, all of these things will help your skin appear brighter and more lively, and down the road also help with skin aging. And then the last thing I'll say is really, as much as you can, try to keep your hands off your face or away from various areas. Skin picking and traumatizing the skin can really lead to severe disfiguration and scarring. And sometimes as patients, we are our own worst enemies. So keeping the hands off of the face can actually do wonders in the long run. So those are some of my favorite tips to hand out.
Dr. Crystal Agu, thank you so much for talking with us on the People's Pharmacy today.
No problem. Thank you for having me.
You've been listening to Dr. Crystal Agu, Assistant Professor of Dermatology and Director of the Ethnic Skin Program at the Johns Hopkins University School of Medicine. Dr. Agu's area of research focuses primarily on skin conditions that disproportionately affect minority populations, with particular emphasis on hair loss.
Lynn Siegel produced today's show. Al Wadarski engineered. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC. This week, the show was recorded in our home studio.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
And by CocoVia, offering plant-based nutrients in the form of cocoa flavanols for brain and heart health. Online at cocovia.com.
If you'd like to buy a CD of today's show or any other People's Pharmacy episode, you can call 800-732-2334. Today's show is number 1223. The number 800-732-2334. Or you can purchase it online at peoplespharmacy.com.
When you visit the website, you could also subscribe to the podcast. We're including information on why quarantine is the perfect storm for hair loss. How does stress affect your hair and your skin? Does it give you hives? We also discuss supplements that may cause skin reactions. The podcast is also available through Apple Podcasts, Stitcher, Google, or your favorite podcast provider. You can find it on our website every Monday morning.
At the website, you can also sign up for our free online newsletter and get the latest news about COVID-19 or other important health stories.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week.